Bismillah ar-Rahman ar-Rahim. License exam for the Laboratory Scientist and Technologist, Part 2. First question. In the fasting state, the arterial and capillary blood glucose concentration varies from the venous glucose concentration by approximately how many milligram, deciliter, or millimole liter? The correct answer is B. It is 5 milligram or 0.27 millimole higher. Second question. Which one of the following values obtained during a glucose tolerance test are diagnostic of diabetes mellitus? The correct answer is B. Fasting blood glucose equal 126 milligram or 6.9 millimole is a diagnostic test for diabetes. Question number 3. Total glycosylated hemoglobin levels in a hemolysate reflect the average blood glucose level of the past 2 to 3 months, average blood glucose level of the past week, blood glucose level at the time the sample is drawn, hemoglobin A1C level at the time the sample is drawn. The correct answer is A. Question number 4. Which of the following hemoglobin has glucose 6-phosphate on the amino terminal valine of the beta chain? The correct answer is A1C. Question number 5. A patient with hemolytic anemia will show a decrease in glycated hemoglobin value, show an increase in glycated hemoglobin value, show little or no change in glycated hemoglobin value, demonstrate an elevated hemoglobin A1. The correct answer is A. Show a decrease in glycated hemoglobin value. Question number 6. An infant with diarrhea is being evaluated for carbohydrate intolerance. His stool elides a positive copper reduction test and a pH of 5. It should be concluded that further tests are indicated, results are inconsistent, repeat post-test, the diarrhea is not due to carbohydrate intolerance, the test provides no useful information. The correct answer is A. We need to do further test to confirm. Question number 7. The expected blood gas result for a patient in a chronic renal failure would match the pattern of metabolic acidosis, respiratory acidosis, metabolic alkalosis, respiratory alkalosis. The correct answer is A. Question number 8. Severe diarrhea causes metabolic acidosis, metabolic alkalosis, respiratory acidosis, or respiratory alkalosis. The correct answer is metabolic acidosis. Question number 9. The following blood gas results were obtained. The patient results are compatible with which of the following? Fever, uremia, emphysema, or dehydration? The correct answer is C. Because we see here low oxygen PO2. Question number 10. At blood pH 7.4, what is the ratio of bicarbonate to carbonic acid? At pH 7.4, 15 to 1, 20 to 1, 25 to 1, 30 to 1. The correct answer is 20 to 1. Question number 11. The reference range for pH of arterial blood measured at 37 degrees centigrade is 7.28 to 7.34 or 7.33 to 7.37 or 7.35 to 7.45 or 7.45 to 7.50. The correct answer is C, 7.35 to 7.45. Question number 12. A patient is admitted to the emergency room in a state of metabolic alkalosis. Which of the following would be consistent with this diagnosis? High total CO2, increased HCO3, low total CO2, increased HCO3, high total CO2 but decreased H2CO3, low total CO2 and decreased H2CO3. The correct answer is A, high total CO2 and increased HCO3. Question number 13. A common cause of respiratory alkalosis is vomiting, starvation, asthma, or hyperventilation. The correct answer is hyperventilation. Question number 15. The most important buffer pair in plasma is phosphate biphosphate pair, hemoglobin imidazole pair, bicarbonate carbonic acid pair, or sulfate bisulfate pair. The correct answer is bicarbonate carbonic acid pair. So the correct answer is C. Question number 16. The primary function of serum albumin in the peripheral blood is to maintain colloidal osmotic pressure, increase antibody production, increase fibrinogen formation, maintain blood viscosity. The correct answer is A, to maintain the colloidal osmotic pressure. Question number 17. The first step in analyzing a 24-hour urine specimen for quantitative urine protein is subculture the urine for bacteria, add the appropriate preservative, screen for albumin using a dipstick, or measure the total volume. The correct answer is D, measure the total volume. Question number 18. The Biot reaction for the analysis of serum protein depends on the number of free amino group, free carboxyl group, peptide bonds, or tyrosine residue. The correct answer is peptide bond. So the correct answer is C. Question number 19. Serum concentration of vitamin B12 are elevated in pernicious anemia in relapse patient of chronic hemodialysis, chronic granulocytic leukemia, or Hodgkin disease. The correct answer is C. Question number 20. The principle of the occult blood test depends upon coagulability of blood, oxidative power of the atmospheric oxygen, hydrogen peroxide in hemoglobin, peroxidase-like activity of hemoglobin. The correct answer is D. The peroxidase-like activity of hemoglobin. Question 21. If the total bilirubin is 3.1 milligram and the conjugated bilirubin is 2 milligram, the unconjugated bilirubin is 0.5 milligram, 1.1 milligram, 2.2 milligram, 5.1 milligram. The correct answer is B, is 1.1 milligram, because the total bilirubin is a summation between the conjugated and unconjugated. You need to subtract total from conjugated to get unconjugated. The difference is 1.1. Question 22. The most specific enzyme test for acute pancreatitis is acid phosphatase, trypsin, amylase, or lipase. The correct answer is lipase. Actually, both amylase and lipase are increased in pancreatitis, but lipase lasts longer time. Because of this, it is more specific enzyme for acute pancreatitis. Plus, in amylase, sometimes it is increased in other cases. Question number 23. Which of the following enzymes are used in the diagnosis of acute pancreatitis? Amylase and lipase, AST and ALT, 5-nucleotidase and GGT, or AST and lactate dehydrogenase. The correct answer is A, amylase and lipase. Question 24. Aspartate aminotransferase is characteristically elevated in diseases of the liver, kidney, intestine, pancreas. The correct answer is liver. Question 25. The most sensitive enzymatic indicator for liver damage from ethanol intake is ALT, AST, GGT, alkaline phosphatase. The correct answer is GGT, is specific for ethanol intake. Question 26. High level of which lipoprotein class are associated with decreased risk of accelerated atherosclerosis? The correct answer is HDL, which is called good cholesterol. Question 27. The most consistent analytical error involved in the routine determination of HDL cholesterol is caused by incomplete precipitation of LDL cholesterol, co-precipitation of HDL and LDL cholesterol, inaccurate protein estimation of HDL cholesterol, or a small concentration of ApoB containing lipoprotein after precipitation. The correct answer is D. Question 28. TSH is produced by hypothalamus, pituitary gland, adrenal cortex, thyroid. Thyroid stimulating hormone is produced by pituitary gland. So the correct answer is B. Question 29. A 45 years old woman complains of fatigue, heat intolerance, and hair loss. Total and free T4 are abnormally low. If the TSH showed marked elevation, this would be consistent with Graves' disease, an adenoma of the thyroid, thyrotoxicosis, primary hypothyroidism. The correct answer is primary hypothyroidism. The correct answer is D. Question number 30. Which of the following hormones regulates normal blood calcium level? Thyroxine, estriol, parathyroid hormone, or growth hormone? The correct answer is parathyroid hormone, PTH. Question 31. Blood received in the laboratory for blood gas analysis must meet which of the following requirements? On ice, thin fibrin strand only, no air bubbles. On ice, no clots, fewer than 4 air bubbles. On ice, no clots, no air bubbles. Room temperature, no clots, no air bubbles. It should be received on ice. Okay, no clots, no air bubbles. Question 32. After a difficult manufacture requiring prolonged application of the tourniquet, the serum potassium was found to be 6.8 millimole. The best course of action is to repeat the test using the same specimen, adjust the value based on the current serum sodium, repeat the test using freshly drawn serum, cancel the test. The correct answer is to repeat the testing using a new sample. So the correct answer is C. Question 33. Blood was collected in a serum separator tube on a patient who has been fasting since midnight. The time of collection was 7 a.m. The laboratory test which should be recollected is triglyceride, iron, LDL, sodium. The correct answer is triglyceride, which should be recollected. Question 34. Which of the following is Henderson-Hasselbalch equation? The correct answer is D. pH equal the constant, okay, plus salt log salt divided by acid. Question 35. Colorimetry is often used to measure chloride in sweat, pH in saliva, bicarbonate in urine, ammonia in plasma. Colorimetry is often used to measure chloride in sweat. So the correct answer is A. Question 36. Amperometry is the principle of BCO2 electrode, PO2 electrode, pH electrode, ionized calcium electrode. The correct answer is PO2 electrode. So the correct answer is B. Now MCQ in microbiology. Question number 1. Proper media for culture of a urethral discharge from a man include sheep blood and phenyl ethyl alcohol agars, eosine methylene blue and sheep blood agars, thioglycolate broth and chocolate agar, chocolate and modified Tyre-Martin agar. So the correct answer is D. Chocolate and Tyre-Martin agar. So the correct answer is D. Question number 2. The lowest concentration of antibiotic that inhibits growth of the test organism is minimum inhibitory concentration, serum inhibitory concentration, minimum bactericidal titer, or maximum inhibitory titer. The correct answer is A. Minimum inhibitory concentration. Question number 3. The steam autoclave method of sterilization uses 15 pound square inch of pressure for 15 minutes, utilize dry heat for 20 minutes, produce a maximum temperature of 100 degrees centigrade, requires a source of ethylene oxide. The correct answer is A. Use 15 pound square inch of pressure for 15 minutes and the temperature will reach 121. Question number 4. A penicillin resistant Neisseria gonorrhea produce alpha homolysine, beta-lactamase, enterotoxin, coagulase. The correct answer is beta-lactamase. So the correct answer is B. Question number 5. Which selective media is used for the isolation of gram-positive microorganisms? Columbia cholecystine with 5% sheep blood, trypticase soy agar with 5% sheep blood, eosine methylene blue, modified tire Martin. The correct answer is Columbia cholecystine with 5% sheep agar. So the correct answer is A. Question number 6. The most sensitive substrate for the detection of beta-lactamase is penicillin, ampicillin, cefotaxime, nitrocephine. The correct answer is nitrocephine. Question number 7. Which of the following specimen requested is acceptable? Feces submitted for anaerobic culture, Foley catheter tip submitted for aerobic culture, rectal swab submitted for direct smear for gonococci, or urine culture for acid-fast bacilli. The correct answer is D, urine culture for acid-fast bacilli. Question number 8. Which of the following antibiotics would routinely be tested and reported for isolates of Pseudomonas aeruginosa? Penicillin, erythromycin, clindamycin, gentamicin. The correct answer is gentamicin, which is routinely tested and reported for Pseudomonas aeruginosa. Question number 9. Viridans streptococci can be differentiated from Streptococcus pneumoniae by alpha hemolysis, morphology, catalase reaction, or bile solubility. The correct answer is bile solubility. The answer is D. Question number 10. Infection of the urinary tract is most frequently associated with Staphylococcus aureus, Escherichia coli, Enterococcus fecalis, or Serratia. The correct answer is Escherichia coli. E. coli is the most organism isolated from urinary tract infection. Question number 11. McConkey media for screening suspected cases of hemorrhagic E. coli O157 must contain indole, citrate, sorbitol, lactose. The correct answer is sorbitol. To differentiate hemorrhagic E. coli from other E. coli. Question number 12. Which of the following gram-negative bacilli ferments glucose? Fecalis, ولا Pseudomonas, ولا Acinetobacter, ولا Yersinia? The correct answer is Yersinia enterocolytica. So the answer is D. Question number 13. Shigella species characteristically are urease positive, non-motile, oxidase positive, lactose fermenter. Shigella are urease negative and oxidase negative, and it is non-fermenter for the glucose. So the correct answer is non-motile. So B. Question number 14. An organism that exhibit the satellite phenomenon around colonies of Staphylococci is Haemophilus influenza, Neisseria meningitis, Neisseria gonorrhea, Klebsiella pneumonia. The correct answer is Haemophilus influenza. Okay. Question number 15. The optimal incubator temperature for isolation of Campylobacter coli group is 4 degrees centigrade, 20 degrees centigrade, 25 degrees centigrade, 42 degrees centigrade. The correct answer is 42 degrees centigrade. So the correct answer is D. Question number 16. The primary isolation of Neisseria gonorrhea requires anaerobic condition, starch media, carbon dioxide, blood, agar. The correct answer is carbon dioxide, because Neisseria gonorrhea is fastidious organism and need carbon dioxide to grow. So the correct answer is C. Question number 17. The diagnosis of Neisseria gonorrhea in female is best made from clinical history, an endocervical culture, a gram stain of cervical secretion, or examination for clue cells. The correct answer is endocervical culture. So the correct answer is B. Question number 18. A patient urine sample has an increased protein and high specific gravity. Which of the following would be a more accurate measure of urine concentration? Osmolality, ketones, refractive index, or pH? The correct answer is osmolality. So the correct answer is A. Osmolality and refractive index both are used to determine concentration, but because the high protein, so refractive index is inappropriate. Osmolality is the best. Question number 19. A urine's specific gravity is directly proportional to its turbidity, dissolved solid, salt content, or sugar content. The correct answer is dissolved solid. So answer is B. Question number 20. The pH of urine measures the free sodium ion, free hydrogen ions, total acid excretion, or volatile acid. The correct answer is free hydrogen ions. Question number 21. Upon standing at room temperature, a urine pH typically decrease, increase, remains the same, change depending on the bacterial concentration. The correct answer is increase. It is B. Question number 22. Which of the following reagent is used to react with ketone in the urine? Sodium nitroprusside, acetoacetic acid, or acetone, or beta hydroxybutyric acid? All these forms are forms of ketones. So the only answer is the sodium nitroprusside is the correct answer, A. Question 23. What is the most likely diagnosis given this microscopic findings? If we see here, we will see white blood cells and some RBCs and bacteria. So it is glomerulonephritis or polynephritis or nephritic syndrome or cystitis. All these, there are no here white blood cells cast. Here for glomerulonephritis, it is for RBCs cast. Polynephritis or for white blood cells cast. So the correct answer is cystitis. D. A white precipitate in a urine specimen with a pH 7.5 would most probably be caused by amorphous urate, white blood cells, amorphous phosphate, bacteria. Since the pH here is 7.5, so the correct answer will be amorphous phosphate. So it is C. Please share, like, subscribe to get the part 3, and good luck inshallah.